Marcus Thompson lay on the hospital gurney, his jaw clenched tight against the pain radiating through his left shoulder. The fluorescent lights above cast harsh shadows across his weathered face, highlighting the fresh cuts and bruises that mapped his recent ordeal. Blood had soaked through the temporary bandage the medics had applied during the helicopter ride from the extraction point. But he refused to acknowledge the wound that was clearly more serious than he wanted to admit. The emergency room at Landstuhl Regional Medical Center buzzed with controlled chaos. Doctors moved between patients with practiced efficiency, their voices mixing with the steady beep of monitors and the occasional overhead page. Marcus had been through this routine before, but something felt different this time. The mission had gone sideways in ways that still made his stomach clench when he thought about it. "Sir, we need to get you into surgery," Dr. Williams said, approaching the gurney with a clipboard in hand. His voice carried the authority of someone who had seen countless wounded soldiers pass through these doors. "The shrapnel is close to major arteries, and we can't wait any longer." Marcus turned his head away, staring at the pale green wall instead of meeting the doctor's eyes. "I'm fine," he muttered, though the tremor in his voice betrayed the pain he was fighting. "Just clean it up and send me back." The doctor frowned, clearly frustrated by the response he had heard too many times before. "Sergeant Thompson, this isn't a request. You're going into shock, and if we don't operate soon, you could lose function in that arm permanently." But Marcus had already retreated into himself, the way he always did when civilians tried to tell him what to do. His mind drifted back to the compound in Afghanistan, where everything had gone wrong. The intelligence had been faulty, the backup had arrived late, and his team had been forced to improvise under heavy fire. The explosion that had torn through the building had sent metal fragments flying in every direction, and he had thrown himself over his teammate Rodriguez without thinking. The memory of Rodriguez's blood on his hands was still fresh, and the guilt sat heavy in his chest. He should have moved faster, should have seen the threat coming sooner. His team was counting on him to heal quickly and get back to them, not waste time in some sterile hospital room letting doctors poke and prod at him like he was broken. Dr. Williams stepped back, recognizing the wall that had gone up behind Marcus's eyes. He had seen this before with special operations soldiers, the way they shut down when they felt vulnerable or out of control. "I'll give you a few minutes to think about it," he said finally. "But this decision can't wait much longer." As the doctor walked away, Marcus closed his eyes and tried to center himself using the breathing techniques he had learned during his early SEAL training. In through the nose for 4 counts, hold for 4, out through the mouth for 4. The rhythm helped calm his racing heart, but it did nothing for the deeper ache that had settled in his bones. The curtain around his bed rustled, and he assumed Dr. Williams had returned with more arguments about why he needed surgery. "Look, Doc," he started, opening his eyes. "I already told you." But instead of the middle-aged doctor, a young woman in blue scrubs stood beside his gurney. She couldn't have been more than 25. With auburn hair pulled back in a practical ponytail, and kind eyes that seemed to see right through his defenses. Her name tag read, Sarah Mitchell, RN. And there was something about her calm presence that immediately put him on edge. "I'm not here to argue with you about surgery," Sarah said, pulling up a chair beside the bed. "But I am here to make sure you're comfortable while you make your decision." Marcus studied her face, looking for the judgment he expected to find there. Most medical staff looked at him like he was being unreasonable, like his reluctance to accept help was some kind of character flaw. But Sarah's expression remained neutral, professional, waiting. "I don't need to be comfortable," he said finally. "I need to get back to my team." Sarah nodded as if this made perfect sense to her. "Where are they deployed?" The question caught him off guard. Most hospital staff avoided asking about missions or deployments, treating that information like classified material they had no business knowing. "Afghanistan," he said cautiously. "Forward operating base near Kandahar. My brother did 3 tours over there," Sarah said, beginning to check the monitors connected to his IV line. "Army Rangers. He used to tell me about the guilt he felt whenever he ended up in medical, knowing his unit was still out there without him." Marcus felt something shift in his chest, a loosening of the tension he hadn't realized he was carrying. It was rare to meet someone who understood, even partially, what it felt like to be torn between taking care of yourself and taking care of your brothers. "What happened to him?" Marcus asked, though part of him wasn't sure he wanted to know the answer. "He's good now," Sarah said with a small smile. "Works as a contractor, training new recruits, but it took him a long time to accept that sometimes the best thing you can do for your team is make sure you come back whole." The words hit closer to home than Marcus wanted to admit. He thought about Rodriguez again, about the way his friend had looked at him with gratitude even as the medics worked to stabilize him for transport. Rodriguez had 3 kids back home, a wife who wrote him letters every day. If Marcus had been too injured to cover him during that explosion, if Marcus hadn't been at full strength, Sarah continued her work in silence, giving him space to process. She adjusted his IV drip and made notes on his chart with the kind of efficiency that spoke to real experience. Despite her young age, there was something reassuring about her competence. The way she moved around medical equipment like she had been born to this work. "How long have you been doing this?" Marcus asked. 2 years, Sarah replied. "But I've been around military medicine my whole life. My father was a Navy corpsman, and my mother worked base hospitals. I grew up understanding what it meant when soldiers came through our doors." Marcus found himself relaxing slightly, though he couldn't quite put his finger on why. Maybe it was her matter-of-fact approach, or the way she treated his injury as serious, without making him feel weak for having it. Most of the medical staff he had encountered over the years seemed to view wounded soldiers as either heroes to be pitied or problems to be solved quickly and efficiently. The pain in his shoulder flared suddenly, making him grunt involuntarily. Sarah noticed immediately and reached for something on the medical cart beside his bed. "This will help with the pain," she said, preparing to add medication to his IV line. "No," Marcus said sharply, pulling his arm away. "No painkillers." Sarah paused, her hand still holding the syringe. "It's just a mild analgesic. It won't impair your judgment or—" I said no. The firmness in his voice was absolute. The kind of tone that had ended discussions with subordinates countless times over the years. But Sarah didn't back down. Instead, she set the syringe aside and looked him directly in the eyes. "Can I ask why?" The question was asked without judgment, with genuine curiosity rather than challenge. Marcus hesitated, unsure how to explain something that probably sounded irrational to someone who hadn't lived his life. "I need to stay sharp," he said finally. "If something happens, if they need me, I can't be foggy from drugs." Sarah nodded slowly, and Marcus got the impression that she was filing this information away, rather than dismissing it as paranoia. "What if we compromise?" she suggested. "Local anesthetic for the area around the wound. Something that won't affect your mental clarity but will make the examination less painful." Marcus considered her offer, weighing his options. The pain was definitely getting worse. And he knew that being stubborn about medical treatment wouldn't help anyone if it meant he couldn't function effectively. Sarah's suggestion seemed reasonable, a middle ground that acknowledged his concerns while still addressing the immediate medical issue. "Okay," he said reluctantly, "but nothing that goes into my bloodstream." Sarah smiled for the first time since entering his cubicle, and Marcus was surprised by how much younger it made her look. "Deal," she said, gathering the supplies she would need for the local injection. As she worked, Marcus found himself studying her movements. There was a precision to everything she did, a careful attention to detail that reminded him of the way his best teammates approached their gear. Every tool had a place, every step had a purpose, and nothing was left to chance. "You said your brother was a ranger?" Marcus said, partly to distract himself from what she was doing, and partly because he was genuinely curious. "Did he ever talk about the transition? From active duty to civilian work?" Sarah paused in her preparation, glancing up at him with a thoughtful expression. "He struggled with it at first," she admitted. "Felt like he was abandoning his responsibilities, like he should still be over there with his guys. It took him a while to realize that experience and training could serve the mission in different ways. The local anesthetic was already beginning to work, dulling the sharp edge of pain that had been making it difficult to think clearly. Marcus felt some of his defensive walls starting to lower. Though he tried to maintain his emotional distance, what changed his mind? he asked. A conversation with his old commanding officer, actually, Sarah said, beginning to clean the wound area with careful, gentle motions. The CO told him that the military had invested too much in his training to waste it on stubborn pride. Said that healing completely and coming back stronger was part of being a professional soldier. Marcus winced. Not from physical pain but from how closely those words echoed his own commanding officer's frequent lectures about taking care of yourself so you could take care of others. He had always been better at the second part than the first. Dr. Williams appeared at the foot of the bed, chart in hand and a more hopeful expression on his face. "How are we doing?" he asked, clearly pleased to see that someone had made progress with the stubborn patient. "Better," Sarah replied. "Sergeant Thompson has agreed to local anesthesia so we can properly assess the wound." The doctor nodded approvingly and moved to examine Marcus's shoulder. With the pain reduced, Marcus was able to remain still, while Dr. Williams probed gently around the edges of the injury. "The good news is that it missed the major blood vessels," the doctor said after several minutes of careful examination. "The bad news is that there are multiple fragments, and at least one is positioned where it could cause significant nerve damage if we don't remove it surgically." Marcus felt his stomach tighten again. Surgery meant being unconscious, being completely vulnerable and out of control for hours. It meant trusting these people with his life in a way that went against every instinct he had developed over years of special operations training. "How long would I be out?" he asked. "The procedure itself should take about 3 hours," Dr. Williams replied. "Recovery time depends on how well you follow post-operative instructions, but you're looking at a minimum of 6 weeks before you can return to full duty." 6 weeks. Marcus closed his eyes, trying to calculate how much could go wrong with his team in 6 weeks, how many missions they would run without him, how many times they might need his experience or his particular skills. Rodriguez was still recovering from his own injuries, which meant the team was already operating with reduced personnel. "There's another option," Dr. Williams continued, apparently reading the conflict on Marcus's face. "We can stabilize you here and arrange for transport to Walter Reed. The surgeons there have more experience with this type of injury and special operations personnel." The suggestion should have been reassuring, but instead it made Marcus feel even more trapped. Walter Reed meant being even further from his unit, surrounded by other wounded warriors whose careers might be ending instead of just pausing. He had visited friends there before, seen the hollow look in their eyes when they talked about medical retirement and disability ratings. Sarah had been listening quietly, but now she spoke up. "Would it help to talk to someone who's been through something similar?" she asked. "There's a patient in the next wing who might be willing to share his experience." Marcus looked at her skeptically. "Another SEAL?" "Actually, yes," Sarah said. "He came in 3 days ago with a similar injury. Different mechanism, same general area. He was just as resistant to treatment initially." Dr. Williams checked his watch and frowned. "I hate to pressure you, Sergeant, but we really can't wait much longer. The risk of complications increases significantly with every hour we delay." Marcus felt the familiar weight of command decisions settling on his shoulders. The burden of choosing between bad options and worse ones. In the field, he was used to making split-second choices that could mean the difference between life and death for his entire team. But this decision felt different, more personal and somehow more difficult. "Can I have 5 minutes?" he asked. "Just to think." Dr. Williams nodded reluctantly. 5 minutes, but then we need a definitive answer." He left the cubicle, pulling the curtain closed behind him. Sarah remained, apparently in no hurry to leave him alone with his thoughts. She busied herself organizing the medical supplies on the cart, but Marcus could tell she was staying close in case he needed something. "You don't have to babysit me," he said. "I'm not babysitting," Sarah replied without looking up from her work. "I'm just finishing my documentation. Hospital policy requires detailed notes on any patient who refuses recommended treatment." The implication was clear. If he continued to refuse surgery, she would have to note his non-compliance in his medical record. It would become part of his permanent file, something that could potentially affect his career down the line. Marcus studied her profile as she worked, noting the concentration in her expression and the way she handled even the most mundane tasks with careful precision. There was something familiar about her approach, something that reminded him of the way the best military medical personnel he had worked with carried themselves. "Sarah," he said, causing her to look up. "Can I ask you something?" She nodded, setting down her pen and giving him her full attention. "That other SEAL you mentioned. What made him change his mind about the surgery?" Sarah was quiet for a moment, as if choosing her words carefully. "He told me it was something his team leader used to say about risk assessment, that sometimes the most dangerous thing you can do is nothing at all." The words hit Marcus like a physical blow, because they were almost identical to something he said regularly to his own team members. It was one of the fundamental principles of special operations. Inaction, in the face of a known threat, was often more dangerous than taking decisive action, even when that action carried its own risks. He thought about Rodriguez again, about the split-second decision to throw himself over his teammate during the explosion. He hadn't hesitated then, hadn't worried about the potential consequences to himself. He had assessed the situation and acted to protect someone under his command. Now he was in a similar situation, except the person under his command was himself, and the threat was his own stubborn pride rather than enemy fire. If he refused surgery and the injury worsened, he would be of no use to anyone. If he lost function in his arm, his career would be over, and his team would lose not just his immediate presence but all of his future contributions. Sarah seemed to sense that he was working through something important, because she remained quiet while he processed. The steady beep of the heart monitor and the distant sounds of the busy hospital provided a backdrop for his internal struggle. Marcus had always prided himself on his ability to compartmentalize, to separate his emotions from his tactical thinking. Now he tried to apply that same discipline to his current situation, viewing it as objectively as possible. The facts were clear. He had a serious injury that required surgical intervention. The longer he delayed treatment, the greater the risk of permanent damage. His team needed him to heal completely and return to full function, not struggle through missions with a compromised arm. When viewed that way, the decision became much simpler. "Okay," he said quietly, the word barely audible above the ambient noise of the hospital. Sarah looked up from her notes. "Okay? I'll do the surgery," Marcus said, his voice stronger now. "But I want to talk to that other SEAL first, if that's possible." Sarah's face broke into another smile, this one tinged with relief. "I'll arrange it," she said, reaching for the phone beside his bed. "And I'll let Dr. Williams know you've agreed to the procedure." 20 minutes later, a wheelchair arrived at Marcus's bedside. The occupant was clearly military despite wearing civilian clothes, his posture and bearing unmistakable even while seated. Marcus estimated he was probably in his early 30s, with the kind of weathered face that spoke to years of deployments in harsh environments. "Tom Bradley," the man said, extending his hand. "I hear you're having some philosophical differences with the medical staff." Marcus shook the offered hand, noting the firm grip and calloused palms that marked someone who spent time handling weapons and repelling gear. "Marcus Thompson, Sarah said you might be able to offer some perspective." Tom gestured to his own shoulder, which was immobilized in a complex-looking sling. "Had my surgery yesterday morning. 3 fragments. One of them sitting right up against the nerve bundle. Took the surgeon about 4 hours to get everything cleaned out." "How do you feel?" Marcus asked, though he could see that Tom was alert and coherent. Nothing like the drugged zombie he had imagined post-surgical patients to be. "Better than I did 3 days ago," Tom replied honestly. "The pain is manageable, and I've got full sensation in my hand and arm. Doctor says I should have complete function back within 8 weeks. 8 weeks was longer than Dr. Williams had quoted, but it was still within the realm of acceptable recovery time." Marcus found himself cautiously optimistic for the first time since arriving at the hospital. "What convinced you to go ahead with it?" Marcus asked. Tom leaned back in his wheelchair, his expression thoughtful. "Honestly, it was something the nurse said to me. Sarah, actually, she asked me what my team would think if I let pride cost me my career." Marcus glanced at Sarah, who was standing nearby but trying to appear busy with other tasks. She had made a similar point to him, but in a more subtle way. "She also told me something that stuck with me," Tom continued. "Something about how the military doesn't just train soldiers, it creates assets. And assets are too valuable to waste on ego." The words resonated with Marcus in a way that surprised him. He had spent so many years thinking of himself as expendable, as someone whose value lay in his willingness to sacrifice himself for the mission. But Tom was right. The military had invested millions of dollars and countless hours in his training and development. Throwing that away, because he was uncomfortable with medical treatment, was wasteful and illogical. Dr. Williams appeared at the foot of the bed, clearly pleased to see Marcus talking with Tom. "How's our consultation going?" he asked. "Good," Marcus said, making the final decision that had been building in his mind since the conversation began. "When can we schedule the surgery?" 2. "We can get you into OR 3 within the hour," Dr. Williams replied immediately. "I've already spoken with the surgical team, and they're standing by." Marcus felt a familiar flutter of pre-mission nerves, the same combination of anxiety and anticipation that always preceded dangerous operations. The difference was that this time, he would be unconscious for the most critical part, unable to monitor the situation or adjust tactics if something went wrong. Sarah seemed to sense his lingering anxiety. "Dr. Williams has performed this exact procedure more than 200 times, she said. "And the surgical team here has some of the best outcomes in the military medical system." "What's the failure rate?" Marcus asked, unable to stop himself from gathering intelligence, even when it might not be helpful. "Less than 2% for complications. And most of those are minor," Dr. Williams replied. "Complete nerve damage is extremely rare. When we operate within the first 8 hours of injury, the statistics were reassuring, better odds than most of the missions Marcus had been on over the past few years." He was beginning to feel foolish for his earlier resistance, though he understood where it had come from. Tom reached out and clasped Marcus's uninjured shoulder. "The hardest part is trusting other people to take care of you," he said. "But sometimes that's exactly what being part of a team means." Marcus nodded, finally understanding what had been bothering him so much about the situation. As a team leader, he was used to being responsible for everyone else's welfare. The idea of being dependent on others, of having his fate in someone else's hands, went against everything his training and experience had taught him. But Tom was right about teamwork cutting both ways. If one of his own team members had been injured and was refusing medical treatment out of pride, Marcus would have been furious with them. He would have seen it as a betrayal of their mutual responsibility to each other. Sarah began preparing his bed for transport to the surgical suite. "Is there anyone you'd like us to contact?" she asked. "Family, or someone from your unit?" Marcus hesitated. His ex-wife had made it clear that she didn't want to be involved in his military life anymore, and his parents had never really understood what he did for a living. His team members were still deployed, probably in the middle of planning their next mission. "My commanding officer," he said finally, giving her the contact information for his unit. "He'll want to know about the surgery and the expected recovery time." As they prepared to move him to the operating room, Marcus found himself thinking about Rodriguez again. But this time, instead of guilt, he felt a sense of resolution. He had made the right call during the mission, protecting his teammate even at the cost of his own injury. Now he was making the right call about his recovery, ensuring that he would be able to continue protecting his team in the future. The journey to the surgical suite passed in a blur of fluorescent lights and ceiling tiles. Sarah walked alongside the gurney, making small adjustments to his IV line and monitoring his vital signs. "Thank you," Marcus said as they approached the operating room doors. Sarah looked down at him with a puzzled expression. "For what?" "For understanding," he said. "For not making me feel weak for being scared." "You're not weak," Sarah replied firmly. "And you're not scared. You're just human." The doors to the operating room swung open, revealing a space that looked like something from a science fiction movie. Bright lights, complex equipment, and a team of masked figures in scrubs all focused on preparing for his arrival. Dr. Williams appeared beside the gurney, now dressed in surgical attire. "Any last questions?" he asked. Marcus shook his head, though one question remained unspoken. As the anesthesiologist began preparing the equipment that would render him unconscious, Marcus found himself wondering what he had missed by being so resistant to help from others. The thought was interrupted by Sarah's voice, speaking quietly near his ear. "Your team is lucky to have you," she said. "And after today, they'll have you back at full strength." As the anesthesia began to take effect, Marcus felt his consciousness starting to slip away. But instead of the fear he had expected, he felt something closer to peace. For the first time in years, he was allowing other people to take care of him, and the world hadn't ended. His last coherent thought before the anesthesia claimed him completely was that maybe Rodriguez had been right when he used to say that the strongest thing a person could do was admit when they needed help. When Marcus woke up several hours later, his first sensation was the absence of pain. The sharp, grinding ache that had been his constant companion since the explosion was gone, replaced by a manageable soreness that felt almost luxurious by comparison. Sarah was sitting in a chair beside his bed, reading a medical journal. She looked up when she noticed his eyes were open and smiled. "How do you feel?" she asked. Marcus took inventory of his body, testing the movement in his fingers and feeling the sensation return to his arm. Everything seemed to be working normally. "Good," he said, surprised by how true it was. "Really good." "Dr. Williams said the surgery went perfectly," Sarah reported. "All the fragments were removed, and there was no nerve damage. You should have full function back within 6 to 8 weeks. Marcus nodded, already thinking about the rehabilitation process and what he would need to do to return to peak physical condition. For the first time since the injury, he felt genuinely optimistic about his future. "Sarah," he said, causing her to look up from her journal again. "That thing you said earlier, about my team being lucky to have me. I think it goes both ways. They're lucky, and so am I." Sarah's smile widened, and Marcus realized that he had learned something important during his time at the hospital. Strength wasn't just about enduring pain or pushing through difficulties alone. Sometimes it meant having the courage to trust other people, to accept help when it was offered, and to admit that even the strongest people needed support sometimes. As he settled back into his hospital bed to begin the long process of healing, Marcus found himself thinking not about what he had lost during the mission, but about what he had gained. He had learned to be vulnerable without being weak, to accept care without losing his identity, and to trust in the competence and dedication of people outside his immediate team. It was a lesson that would serve him well, both in his recovery and in his future leadership responsibilities. And it was a lesson he never would have learned if not for a rookie nurse who understood that sometimes the most important code wasn't something you said, but something you lived.